So now we are going to turn to our Edge Runner recognition. Our Edge Runners are one of the Academy's signature initiatives, under the Raise the Voice mantle, our Edge Runner campaign. And through this initiative, the Academy identifies and showcases nurses who have designed innovative models of care or interventions that improve health, impact policy, and demonstrate successful financial outcomes. Edge Runners are practical innovators who see beyond the status quo and dare to employ new and creative methods to solve health challenges. To date, the Academy has recognized 65 Edge Runners who have created 49 nurse-designed innovative models of care or interventions which are transforming health care delivery and improving health outcomes for patients. Edge Runners successfully demonstrate significant clinical and financial outcomes, as well as sustainability and replicability of their program or intervention. And these achievements ensure their ingenuity will continue to benefit providers and patients throughout our healthcare system. So now it is time to recognize the achievements of our 2017 Academy Edge Runners. Our first 2017 Edge Runners to be recognized are Dr. Carol Baldwin, Dr. Luxana Renaga Orelis, and Ms. Cipriano Cadillo Cisneros. Carol, Luxana, and Cipriana are recognized for their innovative model, Su Sueño, Su Vida, Your Sleep, Your Life, Sleep Disorders and Sleep Health Promotion. Poor sleep is a lifestyle factor that plays a significant role in the development of chronic disease. However, nurses, physicians, and other healthcare workers receive little or no training in sleep disorders, sleep health promotion, or the importance of good sleep to encourage health and well-being. With health inequality and access to care being a significant concern for Hispanics, particularly Spanish-speaking, only persons and families residing in the U.S. border region, Carol, Luxana, and Cipriana and their binational interprofessional team developed and implemented the first ever sleep promotion program to support community-based health promotion in urban and rural districts along both sides of the U.S.-Mexico border. Su Sueño, Su Vida uses various learning tools to teach community health workers, known as promotores, culturally relevant health education and promotion on changing lifestyle behaviors that may improve health. Speaking the language and understanding the culture of individuals and families living in these communities, promotores serve as valuable health resources and bridge the gap between nurses, doctors, dentists, and other health professionals who work with them. The Academy applauds our leaders on their achievement. Dr. Baldwin will accept the plaques on behalf of her partners. Dr. Baldwin?
Thank you all very much. Muchas gracias. I also want to thank and recognize all of my colleagues who worked with us. This wasn't done in isolation. It was a really integrated, interrelated team. Thank you very much.
The Academy is proud to highlight another Edge Runner, Dr. Linda Bieber. Dr. Bieber is being recognized for her intervention reducing depressive symptoms and enhancing parenting in low-income and newly immigrated mothers of infants and toddlers. With infancy and toddlerhood being the period when the most rapid brain and neurocognitive growth occurs, significant levels of depressive symptoms in a mother may compromise essential maternal functions and place the infant-toddler at risk for developmental delays and language delays, cognitive deficits, and later school failure. Linda's research teams conducted over 20 years of sustained research to identify how context-specific maternal stressors, such as economic hardship, immigration, discrimination, or child development disabilities, are linked to maternal depressive symptoms. Being one of the first researchers to recognize the mother-child dyad as an integral unit, Dr. Bieber's nurse-delivered intervention increases maternal self-efficacy through symptom monitoring and control, problem-focused strategies, and improved parenting. Please join me in congratulating Dr. Linda Bieber on her remarkable work and being named an Edge Runner.
I'm very honored on behalf of all of my teams and my mothers and my babies, some of whom are now 18 years old, and we're trying to recruit them to be nurses. When I started this work, I was told I would never get it funded because I was trying to work with discounted lives, lives that had no economic value. We still are discounting motherhood, parenthood, and raising children as an essentially economic contribution to this country, and I want to change that. Thank you.
Our next Academy Edge Runner to be recognized is Dr. Jill Borman. Jill's research on spirituality and its influence on health led to her developing the Mantra Repetition Program, Mind-Body Spiritual Approach to Symptom and Stress Management. This intervention has proven to be a viable non-pharmacological option for treating populations suffering from symptoms of psychological distress. Dr. Borman's research, which received funding from the National Institutes of Health and the Department of Veterans Affairs, included veterans with chronic illness and post-traumatic stress disorder, professional and family caregivers, adults with HIV, childbearing women in labor, homeless women, and healthcare employees. Serving as what Dr. Borman calls a pause button for the mind, the Mantra Repetition Program helps slow down thoughts and behaviors and develop one pointed attention symptom for stress management. This hands-on, non-pharmacological and therapeutic program is shown to reduce, decrease reactivity, and immediately bring the individual into the present moment for a rest. Please join me in recognizing Jill Borman for her innovative program.
Thank you. Thank you so very much for this recognition. This work has been my passion and my dream to try to disseminate something so simple. We've taken ancient spiritual practices that have been around forever, that are universal, and packaged them hopefully in a way that every one of you and everyone else can benefit from. Mantra repetition comes from millennia of practice from all different cultures and so forth. And I think that each and every one of us could use a pause button for the mind, or I've often thought of it as truly a screensaver for the mind. Thank you very much.
Our next Academy Edge Runner to be recognized is Dr. Cheryl Krause. Cheryl founded Canines Providing Assistance to Wounded Warriors, or CPAW, a research initiative focused on how nurses and other healthcare providers may employ human-animal bond to provide the best quality care to veterans and their families. Unlike prior animal-assisted interventions, which were based on subjective accounts and surveys, Cheryl and her team employ scientific, objective scales of measurements that demonstrate how veterans benefit from animal presence and interaction. Despite prevention efforts, an estimated 20 veterans die every day from suicide, and many more suffer from invisible wounds of war related to their service, including depression, diminished internal control, lack of resiliency, social disconnectedness, and suicide ideation. CPAW's animal-assisted intervention is a non-invasive, low-risk intervention which helps alleviate these symptoms. CPAW partners with local, national, and international researchers, policymakers, and community organizations to research the benefits of the human-animal bond and in advocating for veterans' health. Cheryl's animal-assisted intervention research has gained national attention among veterans organizations and elected policymakers. She travels regularly to Washington, D.C. to meet with legislators and stakeholders, and her projects have captured the attention of legislators on both the federal and local level. Cheryl, please join me on the stage, and I hope you brought one of those canines with you.
Thank you all so much, and thank you for the Academy for recognizing CPAW, which stands for Canines Providing Assistance to Wounded Warriors. But I don't think the thanks should go to me. I think it should go to our military. So I'd like to give a round of applause for our active duty military and our veterans. It's so important for us as a society and as nurses to really care for our soldiers and our warriors. And so with this initiative, I'm able to turn a passion of canines, which I have 2 dachshunds and I'm representing with a pin. I don't have a real dog with me today, but it's so important to really follow your passion, and I have followed mine, and it's being rewarded. So thank you so much for this honor.
Our next 2017 Edge Runners to be honored today are Doctors Whitney Nash and Sarah Robertson. So Whitney and Sarah's model of care, the Kentucky Racing Health Services Center, is a not-for-profit, nurse-designed and nurse staff clinic that provides the full spectrum of primary care to low-wage migrant workers essential to Kentucky's thoroughbred racing industry and their family members. Health care is neither provided nor affordable for this hidden population of individuals, many of whom are unfamiliar with English and work 7 days a week beginning at 4 a.m. The clinic is strategically located 1 block from Churchill Downs and charges a flat rate of $5, which includes lab work. In addition to 4 primary care nurse practitioners, the Kentucky Racing Health Services Center also has a women's health nurse practitioner, a psychiatric nurse practitioner, and volunteer Spanish language translators. The clinic has 2 key affiliations: the Kentucky Racing Health and Welfare Fund, which provides funding derived from uncashed pari-mutuel tickets at horse racing tracks throughout Kentucky, and the University of Louisville, which provides students from a variety of fields the opportunity to obtain experience while serving the needs of people in this community. Please join me in applauding Dr. Whitney Nash and Dr. Sarah Robertson. Right the first time. A little bit. Yeah, there you go. Okay.
I'll make my remarks brief because Sarah wants to talk too. So I want to thank the Academy. This is an incredible honor for us. And I'd also like to thank Dr. Cindy Logston, who is a colleague who encouraged us to go ahead and make the application for this prestigious honor. And I'd like to make one other comment. I thought it was interesting as we were going through the profiles of the other Edge Runner recipients that at least 3 of these programs are addressing issues relative to immigrant health, which is certainly something I would hope that our current administration would take under advisement.
I would just like to say that if big corporations like Google and Humana corporate offices and Home Depot corporate offices can see the value of keeping employees healthy and providing health care, that we should recognize that value for all people, including those people that are invisible, racetrack workers, agricultural workers, people that build homes and they're in construction, that all those people deserve health and will build our economy if we can keep everyone, all of our workforce healthy. Thank you.
Our next 2017 Edge Runners are the team of Dr. Linda Sarna and Dr. Stella Bialis. Designing and implementing a program and project which reduces the use of tobacco, the leading cause of preventable deaths worldwide, is a valuable and noteworthy achievement. Linda and Stella's intervention, Tobacco-Free Nurses, is not only commendable for improving the health of those called to the nursing profession, but also the patients for whom they care. Through its award-winning website, www.tobaccofreenurses.org, this initiative provides national and international tobacco cessation education to practicing nurse clinicians, tobacco control resources for patient care, smoking cessation support and assistance to nurses and nursing students, and methods to enhance nurse leadership in advocacy and promoting a tobacco-free society. The project's Pocket Guide, Helping Smokers Quit, a guide for clinicians, has been one of the most widely requested print documents from the Agency for Healthcare Quality and Research and Quality. As of February of this year, more than 6,000 nurses had formally participated in the program's educational and policy efforts in the United States and 8 other countries. Please join me in applauding Dr. Sarna and Bialis for their wonderful model of care.
Knowing us, you'd know we'd have a few words to say. First, I want to thank the Academy. I want to thank each and every one of you of the tremendous support that you have given us, especially through the Health Behavior Expert Panel on all things related what nurses can do in tobacco control. What we do is very simple. We try to help smokers, help patients quit. But we're very purposeful in that we want to impact all of the 19 million nurses and midwives worldwide to make sure that they have the tools necessary to do so. And this type of recognition enhances that publicity. Stella?
Thank you again. Just repeating my thanks to the Academy, my thanks to Linda for being the best partner in crime one could ever have. And I would just like to end by asking those of you who were here early and heard when Linda Baldwin talking about it, there's over 20 states that are still not smoke-free. So if you're a nurse that work in one of those states, please go home and start working to provide smoke-free environment for all. It is about equity, social justice, and we'll love to help. Thank you.
Thank you.
And our final 2017 Edge Runner we want to honor this morning is Dr. Sarah Zanton. Sarah's nurse-designed multidisciplinary intervention, Community Aging in Place, Advancing Better Care for Elders, or CAPABLE, assists older adults in acquiring the skills, the strength, and necessary home modifications to support their independence. The inability of older adults to successfully manage everyday life functions such as bathing and dressing, preparing food, taking medications, increases hospital admissions and the likelihood of being admitted to expensive nursing homes. Working collaboratively across disciplines, Dr. Laura Gitlin, an applied research sociologist, CAPABLE incorporates nursing, occupational therapy, and handymen to work, help older adults age in place. A personalized and in-home assessment of each older adult's mind, body, and spirit conducted to arrive at the goals which will enable that individual to age comfortably at home. Testing of Dr. Zanton's program among older adults on Medicaid and Medicare showed that 75% of participants improved their self-care over a 5-month period, with the average participation cutting in half their disability. Dr. Zanton's intervention is currently implemented in 13 cities, in 8 states, and in a variety of healthcare settings. Please join me in congratulating Dr. Sarah Zanton on this innovative work.
Thank you so much. This is really a thrill to receive, and as we've all said, it takes a village to make anything happen in research. So thanks to all the collaborators, and especially to Dr. Laura Gitlin, who was mentioned. If we address function and people's own goals in our care, we can decrease hospitalization and nursing home admission and improve quality of life. Yet it's often dismissed in clinical care as something we can't do anything about. So I want to send you home with that thought.
Could all of our 2017 Edge Runners come back up on stage for a group photo, please?